Joining me to discuss this is infectious disease expert Dr. Amesh Adalja. He's an assistant professor at Johns Hopkins School of Public Health and a senior scholar at the School Center for Health Security. Dr. Adalja, thanks so much for coming on the show. I think we're all a bit relieved to have Biden in office now in terms of COVID response, but we're coming out of the Trump presidency, one that did not believe in wearing masks, didn't take this pandemic or the science behind it seriously. Have a listen to how Dr. Fauci described the whole thing earlier today.
It was very clear that there were things that were said, be it regarding things like hydroxychloroquine and other things like that, that really was uncomfortable because they were not based on scientific fact.
How much of a price are we still paying now, January 2021, because we were led by an administration in 2020 that didn't believe in the basic science surrounding this pandemic and its treatment?
I think the entire trajectory of this pandemic can really be traced to inaction that happened probably about a year ago, when there was a lot of evasion, when the wrong decisions were made, when there wasn't really a recognition of what this virus meant. And we basically got ourselves into a situation that was very predictable if you looked at the biological characteristics of the virus. And it's not something that was surprising to many of us in the field, because if you let a virus that efficiently spreads basically go unchecked for 2.5 months, from January till probably mid-March before you start to do something, you're going to get the situation you had in New York, and you're going to seed the entire country, and you're going to leave governors with very blunt tools like the ones they deployed.
Indeed, and there were blunt tools, there was inaction, you're right about all that. Just deal with those clips of Anthony Fauci that we were playing a few moments ago, because like a lot of people, I'm one of those journalists who say, let's listen to the science, follow the science. We've heard that a lot in recent months. The problem is, okay, Donald Trump messed it up for most of 2020, but in those early weeks, we were listening to the science. We were listening to Fauci, the CDC, the WHO, and they were all saying, don't wear masks.
Well, I think that the mask issue is a little bit more complicated, and it has to go with what we knew about coronaviruses and what we knew about the first SARS. And there wasn't evidence at that time that people with no symptoms at all could spread it. We've always said that if you're sick, you need to wear a mask. And what we found is that there was pre-symptomatic spread. That wasn't anything that we could have known at that time. There was data coming out, and the data started to emerge, and that's why the recommendation changed. It wasn't that Dr. Fauci was wrong. He wasn't wrong based on the data that we had on that day. It's just that science evolves, and you have to change your recommendations based on what you're learning. We were extrapolating from other coronaviruses. But the science that I'm talking about that wasn't followed was the testing, tracing, isolating, the lack of a public health infrastructure, yes, the fact that we had a flawed test from the CDC that was only given to state health labs and nobody could test, and you could only test people from China. And we knew that this virus had already escaped China, and we knew there were people with mild illness who we were forbidden to test. Those are the main mistakes that we made that I think would have averted what happened. It would have been much more like Taiwan if I think we did it right.
So on that note about testing and tracing and a national infrastructure, Joe Biden's team wants to fix a lot of that in a short space of time. You listened to the plan today, from the mass vaccination campaign to mandating masks to protecting certain vulnerable communities. Out of all the things you heard from Biden today and yesterday, what do you think is most essential to get us through this right now? What is number one on that list that needs to be done of all the things he's promising to do?
The number one thing has to be the vaccine. We have a solution at hand. We just need to get it into the arms of Americans. That will end this pandemic. So we need to really go all stops out, basically a warlike effort to get vaccines into people's arms and really not allow any obstacles to be in the way of that. That's how we get through this pandemic. That's what Donald Trump left us with, is a vaccine is the only solution, because we're not going to be able to test, trace, and isolate ourselves out of several 100,000 cases per day in hospitals that are on the brink. We need to get vaccine into people's arms. That has to be the priority.
And of course, how many people we can get those vaccines into is a big issue. Dr. Fauci said earlier today that if we could get to 70 or 85% of the population via mass vaccination, we could reach a level of herd immunity. And he said something similar earlier. He's talked about getting back to normal with herd immunity by maybe August, September of this year. Given how far behind we are on some of those targets, we were supposed to be at 20 million at the end of December. We're not even at 20 million now. Can we still reach 75, 80% herd immunity? Can we still get back to normal, quote unquote, by August, September?
I do think that's the case. We are seeing accelerations of vaccination. And remember, we're going to start seeing benefits from the vaccine once we get our vulnerable populations vaccinated. And that's a little bit of a lower threshold. So phase 1A includes nursing home residents. And if you've been to a hospital, you know that nursing home residents still comprise a lot of the people that are hospitalized, a lot of people that are dying. And once we get that group vaccinated, hospitals will start to have some pressure lift off of them. And that's going to change the risk perception. So we will start to see things get better with the vaccine sooner. But I do think for herd immunity, for the entire population, we are looking at late summer, and we need to make sure we get there by making sure states have the resources to turn these vaccines into vaccinations.
Yeah. And of course, to go with the vaccine, to go with the testing, you need a national strategy. Our failure to handle this crisis comes not just from the fact that the previous president didn't want to do a national plan, it was kind of up to the states, but you also have a reality that in the United States, it's very hard to do anything at a national level, a federal level. Even Joe Biden's mask mandate only applies in federal buildings, interstate travel, etc. He can't force the governor of Texas or the governor of whatever state to do something that they don't want to do. You compare that with the UK, for example. You have a conservative leader there, very Trumpy leader, Boris Johnson, who was also very late to the pandemic. They have horrible death rates in the UK right now. And they've implemented one of the strictest lockdowns they've ever had, nationwide, with massive fines, police presence. You can't do that here. Even if, Joe Biden, no matter how good or popular president he is, cannot force 50 independent states to do that kind of lockdown that they're doing in the UK, can he? And that's a problem, isn't it?
Well, I think what we have is a federal system, and the states do have a lot of power. But what we've seen in other pandemics and other emerging infectious disease emergencies, thinking about Zika, thinking about Ebola, is that you have the CDC issuing guidance to the states, and the states are likely to follow most of it, and it works pretty well. But what we saw in this pandemic was the CDC basically sidelined since February, unable to really speak with truth to power, unable to really give unvarnished advice to the states without worrying about the political implications. And I think that's really what's caused this hodgepodge nature of how we've responded to the pandemic, with one state better than another with totally different policies. I think once you have the CDC driving this again, I think we'll start to see more homogeneity between what the best practices are. And it doesn't necessarily mean it's going to be the same for every state, because we do have different demographics and different transmission dynamics in each state. So you want to make sure that you're right sizing it for that state, and what's driving the pandemic in a given state might not be the same across the border, but you want the CDC to be able to give guidance to the states so that they can do the best that they can.
And Dr. Adalja, we've got 30 seconds left. I do want to ask you this. Once you've got everyone, or 85% of people, vaccinated, when do you have to do it again? With the flu shot, we have to take it every year. When do we have to do this all again in 2022?
We don't have that data yet. We think that likely there's going to maybe a need for a booster, but it might not be 1 year from now. It could be 2 years, 5 years. We have to do those studies, and it takes time. We have to follow these vaccinated individuals and see what happens to them, what happens to their antibodies, what happens to their T cells, when do they get susceptible to reinfection. So I think it's too early to know exactly when it will be.
Okay, well, we have to wait and see for that. A lot of people are wondering what the answer to that question is. Dr. Amesh Adalja, thank you so much for your insights today. Appreciate it.